Hello. My name is Rodrigo Villarreal. I'll be your host for today. So welcome to the SIMI Show. Before we begin, I must tell you of how this show is gonna fall short. First of all, Oprah's not gonna be your host. I am, which means no giveaways. Also, this is not a show for celebrities or any Trump-related news. And lastly, this is not the show where we find out which of these two guys is the father. Okay? But what there is going to be today is knowledge on today's topic, pulmonary arterial hypertension, high blood pressure that's not entirely a result of your McDonald's diet or your wife. And here to help us with that is Dr. Henderson. Hello. Thanks for coming. So tell us, doctor, what is pulmonary arterial hypertension?
Well, pulmonary hypertension is high blood pressure in the lungs or pulmonary circulation. As you might know, the lungs need a constant supply of blood to function normally, and blood coming from the right ventricle to the lungs is usually high pressure and low resistance. Logically, if it is high pressure, you want to keep the resistance as low as possible.
But why do you need low resistance? What happens if you don't have low resistance?
Well, you want low resistance because if there is vasoconstriction or your arteries are constricted and it causes more resistance, then that will put more pressure on your heart and more on your right ventricle, which could lead to heart failure or more complications.
Ah,
So you have a lower chance of getting cardiovascular diseases if your pulmonary circulation is at low resistance, but if you're at higher resistance, that can be fatal because of arterial remodeling and other complications.
and what is arterial remodeling?
Arterial remodeling is basically redesigning of the arterial walls. And this can have a positive or negative outcome. Positive being that if you are into high intense workouts or high altitudes, your arterial walls will expand, which causes more oxygen to be delivered throughout the body. It can be negative for many more reasons being a dysfunction in ion channel, which can cause a cascade of events and which can lead to cell proliferation. Proliferation meaning there are many more cells multiplying than there are going through apoptosis. And this basically means there are more cells on the arterial wall, narrowing the passageway.
Okay, and now I will present Alex. She's a postdoc from Dr. Young's lab, and she's been a great help to me, and she's provided me with many answers in the course of trying to learn more about pulmonary arterial hypertension. And I will show you a little sort of interview of some of the questions she's answered me, and I hope it will be helpful for you guys. What is PAH?
Pulmonary arterial hypertension is a fatal and progressive disease which predominantly affects women. It usually culminates in right heart failure and the death if it's left untreated. The lungs is the only organ in the body which receives entire cardiac output. So pulmonary vasculature is maintained in high flow, low pressure, low resistance state under normal physiological conditions. Pulmonary vasculature is composed of pulmonary arteries, precapillary arterioles, capillaries, and pulmonary veins. The wall of pulmonary arteries is thin and myogenic tone is small compared with resistant arteries like renal or coronary or cerebral arteries. Pulmonary vascular distension and recruitment, which means opening of the closed blood vessels, are the two important mechanisms to reduce pulmonary vascular resistance when cardiac output is higher or blood flow is increased, for example, if you do heavy exercises. Increased pulmonary vascular resistance is the major causes for the elevated pulmonary arterial pressure and leads to pulmonary arterial hypertension. Increased pulmonary vascular resistance demands the right heart work harder and cause right heart hypertrophy and right heart failure and eventually the death in patients with pulmonary hypertension.
So now I still have some questions, and the first one is about potassium channel dysfunctions, and I would like to know what causes them.